Here is what most people get wrong about lowering blood pressure after 60. They assume the whole job is subtraction. Cut the salt, cut the coffee, cut everything with flavor, and hope the numbers drift down. But in 2015, researchers at Queen Mary University of London ran a placebo-controlled trial and found that adding one specific food, about 1 cup a day, was associated with a drop in systolic blood pressure of roughly 8 points over 4 weeks. 8 points from adding something, not taking it away. That food is one of 5 I want to walk you through today. All 5 are ordinary. All 5 sit in a regular grocery store. None of them require a prescription. And here is why this matters specifically after 60. As we age, the large arteries naturally stiffen, which is why the top number, the systolic number, tends to creep up even in people who walk every day and have never carried extra weight. Later in this video, I will introduce you to a man named Walter, who is exactly that person. Trim, active, 71 years old, and still sitting at 148 over 86. And I will show you why that happens and what the research suggests he can do about it. In the next few minutes, I am going to give you the 5 foods, the amounts that were actually used in the studies, the named research behind each one, and the specific mistakes that quietly cancel the benefit. Because here is the strange part. One of these 5 foods is probably in your kitchen right now, and the way most people over 60 prepare it wipes out most of what it could do for their blood pressure. Another one of the 5 is a food that many of you have deliberately removed from your diet, believing it works against your heart, when the research points in the other direction. I will name both before we are done. Here is exactly what I am going to walk you through. Promise number 1 is the root vegetable from that London trial, the daily amount that produced the 8-point drop, and the cheaper cooked form of it that performed nearly as well as the juice. Promise number 2 is the everyday fruit that helps your kidneys move excess sodium out of your body. Plus the one group of people over 60 who need to ask their doctor before adding more of it, because for that group, more is genuinely not better. Promise number 3 is the breakfast food most of you already own, the specific version that showed results in pooled clinical trials, and the supermarket version that quietly sabotages the whole effect. Promise number 4 is a snack food from a Penn State study, associated with about a 4-point drop in systolic pressure, along with the 30-second label check that decides whether it helps you or works against you. Promise number 5 is the food many of you have been avoiding on purpose, the 2021 study of more than 900 adults that suggests you may want it back on your shopping list and the exact type to buy. Every one of these comes with a number, a named source, and a serving size. So when this video ends, you can act on all 5 at your very next grocery trip. Before we start, one thing you should know about me and about this video. I am a physician, and my focus is cardiovascular health in adults over 60. I spend most of my week talking with patients about numbers exactly like the ones we are going to discuss. But this video is education. It is not medical advice for you personally. Your own doctor knows your history, your kidneys, and your medication list, and I do not. So keep your doctor in the loop on everything you hear today, especially if you take blood pressure medication, because food and medication can pull in the same direction. And that matters. Let me tell you about Eleanor. Eleanor is 68 years old. She lives in Grand Rapids, Michigan, in the same brick ranch house she has lived in since 1994. She is a composite of patients I have seen many times, so the details are blended, but the pattern is real, and I suspect it will sound familiar. Last October, Eleanor went in for her annual physical feeling perfectly fine. The nurse wrapped the cuff around her arm, waited, frowned slightly, and took the reading a second time. 154 over 89. Eleanor had been managing what she called borderline pressure for about 6 years on a single low-dose medication, and her readings had usually floated in the high 130s. Now her doctor was using the phrase, second medication, and Eleanor was doing what a lot of people do in that chair, she was quietly panicking. She was not afraid of the number itself. She was afraid of the trajectory. 1 pill becoming 2, 2 becoming 3, each one with its own side effects, each one confirming a story she was telling herself about decline. So she asked her doctor a very direct question. Is there anything I can eat or stop eating that would actually move this number, or is that all wishful thinking? Her doctor gave her an honest answer, which is the same answer I am going to give you. Food alone is usually not a replacement for medication once pressure is established, and nobody should stop a prescribed medication based on a video. But the effect of specific foods on blood pressure is not folklore. It has been measured in controlled trials with numbers attached. Eleanor stayed on her medication exactly as prescribed, and over the following 12 weeks, she made 5 specific changes to her grocery cart, the same 5 we are covering today. She also bought a $50 home blood pressure cuff and measured every morning before coffee, seated, feet flat, arms supported, which is the measuring technique guidelines recommend. By week 12, her morning average had come down to around 138/82. That is roughly a 16-point improvement in her systolic number. Now I want to be careful here because this is the part where health videos tend to overpromise. Eleanor's result is Eleanor's result. She was also walking most mornings. She stayed on her medication, and some of that improvement may simply be a calmer reading at home versus a nervous reading in a clinic, which is a real and well-documented effect. Your result may be smaller, it may be slower. For some people it will not come at all through food. But here is why I am opening with her story. Eleanor is not unusual. Eleanor is typical of the person this research applies to most directly, an adult over 60, already doing some things right, whose grocery cart was quietly working against her arteries in 5 specific ways. And the decision she made in that exam chair to treat food as a tool with numbers attached instead of a vague hope is a decision available to almost everyone watching this. To understand why these particular 5 foods matter, you need to understand what blood pressure actually is, and I want to give you a picture you can hold on to. Forget the garden hose. Think about a town water tower. The pressure at any faucet in that town depends on 3 things: how much water is in the system, how wide the pipes are, and how flexible those pipes are, because pipes with a little give absorb surges smoothly, while rigid pipes transmit every surge at full force. Your circulation runs on the same 3 levers. Volume is your blood volume, and it is heavily controlled by sodium. Eat more sodium than your kidneys can comfortably excrete, and your body retains water to dilute it, raising the pressure at every faucet. Pipe width is controlled largely by nitric oxide, a molecule your vessel linings produce to tell the arteries to relax and widen, and the cells that make it become less productive with age, so by our 60s and 70s our pipes sit slightly narrower by default. And pipe flexibility is the stiffening I mentioned at the top of the video. Decades of pulsing gradually replace the elastic fibers in the large arteries with stiffer collagen, which is why systolic pressure, the surge pressure, is the number that climbs with age, and why Walter, our trim and active 71-year-old, can do everything right at the gym and still see 148 on the cuff. Now here is why this framework matters for the rest of the video. Each of the 5 foods works on one of these 3 levers. Some help your kidneys drain excess volume. Some feed the nitric oxide pathway and widen the pipes. Some appear to support the pipe lining itself. None of them rebuild a 60-year-old artery into a 30-year-old artery. Nothing does that. But the research suggests each one can nudge its lever a few points, and a few points on 3 different levers adds up to something clinically meaningful. The largest demonstration of that principle is the DASH trial, a study funded by the NIH and published in the New England Journal of Medicine, which found that a food pattern built around exactly these kinds of levers lowered systolic pressure by around 11 points in people with high blood pressure. an effect in the same neighborhood as a starter dose of medication. Food is not a replacement for your prescription, but it is not decoration either. It is a lever. And Eleanor's 16 points make more sense once you see which levers she was pulling. The lever idea becomes much clearer when you watch it fail and succeed in different people. So let me give you 3 more composites from patterns I see constantly. Start with Frank. Frank is 74, lives outside Tulsa, and swears he never touches the salt shaker, which is true, and which is also why his pressure confused him. Frank's reading at his last visit was 151/88. When he actually tracked his food for a week, the sodium was hiding in 3 places: his breakfast sausage, his deli turkey, and his canned soup, which together were putting him well over 3,000 milligrams of sodium a day, when the American Heart Association suggests most adults aim closer to 1,500. Frank's system was carrying extra volume every single day, and no amount of avoiding the shaker was going to fix it, because roughly 70% of the sodium in a typical American diet comes from packaged and restaurant food, not from the shaker. For Frank, the foods in today's list that move the volume lever, especially the potassium-rich ones, mattered most, and so did swapping the soup and the deli meat. Within about 10 weeks of those changes, his home readings had settled into the high 130s. Not cured, improved. Now Rosa. Rosa is 66, lives in Sacramento, and takes amlodipine, a common calcium channel blocker, 5 milligrams every morning. Rosa watched a video like this one, got enthusiastic, and added a large glass of beet juice every day without telling anyone. 2 weeks in, she stood up from her armchair one evening and the room tilted. Her home reading that night was 104/62. Nothing terrible happened, but that lightheadedness is exactly why I keep repeating the phrase, talk to your doctor. Foods that genuinely lower blood pressure stack on top of medications that lower blood pressure. That is not a reason to avoid these foods. In Rosa's case, her doctor was actually pleased, kept the beets, and adjusted her plan with proper monitoring. It is a reason to make the change with your doctor watching the numbers, particularly if you are on 2 or more medications, because in older adults, pressure that dips too low raises the risk of falls. And after 60, a fall is never a small thing. And then there is Walter, the man I promised to come back to. 71, lives in Vermont, hikes on weekends, weighs what he weighed at 45, and could not understand his 148/86. 2 things explained it. The first was the arterial stiffening we covered, which is universal and not his fault. The second showed up in his food log. Walter ate almost no potassium. His diet was clean by most standards, but it was built on chicken, rice, eggs, and coffee, and his potassium intake was barely half of the roughly 3,400 milligrams a day that dietary guidelines suggest for men. Potassium is the counterweight to sodium. It signals the kidneys to excrete sodium rather than hoard it, and it helps the vessel walls relax. A diet can be low in junk and still low in potassium, and that combination is remarkably common in people over 60 who think they are already eating well. Walter did not need to eat less of anything. He needed to add. Which brings us finally to exactly what to add. Here are the 5 foods in order with the numbers behind each one. Food number 1 is beets. This is the root vegetable from the Queen Mary University of London trial, published in the journal Hypertension in 2015. In that study, adults with high blood pressure drank about 1 cup of beetroot juice daily, roughly 250 milliliters, for 4 weeks, and compared to the placebo group, their systolic pressure came down by around 8 points on average. The mechanism is the nitric oxide pathway, our pipe-width lever. Beets are dense in dietary nitrate, which your body converts into nitric oxide, partly using bacteria that live on your tongue, and that extra nitric oxide signals the arteries to widen. 2 practical notes. You do not have to drink juice. Cooked whole beets carry the same nitrates, so a serving of roasted or boiled beets most days of the week, or the vacuum-packed cooked beets sold near the salad section, gets you into the same territory for less money. And one honest caveat. If you have a history of kidney stones, beets are high in oxalates, so ask your doctor first. Also, do not be alarmed if things look pink the next day. That is harmless, and it surprises everyone the first time. Food number 2 is the banana, and more broadly, the potassium-rich produce family it represents. One medium banana carries a little over 400 milligrams of potassium. This is the volume lever, the Walter lever. The American Heart Association specifically recommends increasing potassium from food as a strategy for blood pressure, because potassium helps the kidneys excrete sodium and eases tension in blood vessel walls. If bananas bore you, a baked potato with the skin actually carries more potassium than a banana, and so do white beans, spinach, and cantaloupe. The realistic goal is potassium at most meals from food, not from supplements. And here's the caveat I flagged in the promises, and it is the most important caveat in this entire video. If you have chronic kidney disease, or you take certain blood pressure medications, including ACE inhibitors like lisinopril, or potassium-sparing diuretics like spironolactone, your body may not clear potassium normally, and deliberately loading up on it can push your blood level too high, which can affect heart rhythm. For that group, more is genuinely not better. This is a 5-minute conversation with your doctor or pharmacist. Have it before you change anything. Food number 3 is oats, and this is the food that is already in your kitchen being prepared wrong. The active ingredient is a soluble fiber called beta-glucan. Pooled analyses of clinical trials have associated regular oat consumption with modest reductions in blood pressure, typically in the range of 2 to 3 systolic points, along with improvements in cholesterol, which matters because blood pressure and cholesterol damage arteries as a team. 2 to 3 points sounds small, until you remember we are pulling multiple levers at once. Now, the sabotage. The benefit lives in the intact fiber, which means steel-cut oats or old-fashioned rolled oats. The flavored instant packets that dominate the cereal aisle are a different product. Many of them carry added sugar, and some carry a surprising amount of added sodium, which means the packet version can quietly push the volume lever in the wrong direction, while you believe you are eating heart food. Buy the plain rolled or steel-cut oats and sweeten them yourself with fruit. Sliced banana on oatmeal. And you have stacked food 2 on food 3 in one bowl. Food number 4 is pistachios, and the broader answer is unsalted nuts. Researchers at Penn State ran a controlled feeding study in adults and found that a daily serving of pistachios was associated with a drop in systolic pressure of roughly 4 points. Nuts bring magnesium, potassium, healthy fats, and arginine, an amino acid your body uses as raw material for nitric oxide. So this food touches both the pipe width lever and the lining of the pipes. The serving in that research was modest, about a small handful a day, roughly 1 ounce, which matters because nuts are calorie dense, and this is an ad, not an all-you-can-eat invitation. And here is the 30-second label check from the promise stack. Turn the bag over and read the sodium line. It should say 0, or very close to it. The salted versions, common in the snack aisle, can carry 150 milligrams of sodium or more per serving, and eaten daily, that steadily pushes the volume lever against you. Unsalted, dry roasted, or raw. That one word on the label is the difference between a food that works for your pressure and one that works against it. And food number 5 is the one many of you removed on purpose. Yogurt. Somewhere along the way, a lot of people over 60 filed all dairy under suspicion, and full-fat dairy in particular. But in 2021, researchers from the University of South Australia and the University of Maine published a study of more than 900 adults, And among the participants who had high blood pressure, the regular yogurt eaters averaged systolic readings roughly 7 points lower than those who rarely ate it. Now that was an observational study, so it shows an association, not proof of cause, and I want to be straight with you about that distinction. But the finding fits a larger pattern. Yogurt delivers calcium and potassium, both involved in vessel function, and fermented dairy feeds the gut bacteria that increasingly appear connected to blood pressure regulation. The type to buy is plain, unsweetened yogurt, Greek or regular, because the flavored cups can carry 15 to 20 grams of added sugar, and the small, drinkable dessert-style yogurts are closer to pudding than to medicine. Plain yogurt, a spoon of berries, a few of those unsalted pistachios on top, and you have quietly stacked 3 of the 5 foods into one breakfast that takes 90 seconds to assemble. Before we close, there is one more item that did not make the list of 5 because it is a drink, not a food, and almost nobody talks about it. Hibiscus tea. In 2010, researchers at Tufts University published a randomized, placebo-controlled trial in the Journal of Nutrition. Adults with mildly elevated blood pressure drank 3 cups of hibiscus tea daily for 6 weeks, and their systolic pressure fell by around 7 points on average compared to placebo, with the biggest effect in the people who started with the highest readings. Hibiscus is caffeine-free. It costs pennies per bag, and it appears to work partly through the same vessel-relaxing pathways we have been discussing, so it slots neatly into an afternoon or evening routine where coffee no longer belongs. The caveat, and there is always a caveat, hibiscus may have a mild diuretic effect and may interact with some medications, including certain diuretics and possibly some diabetes drugs. So if your medication list is longer than one line, run it past your pharmacist before you make it a 3-cup-a-day habit. If you get the green light, this is probably the highest return $2 purchase in the entire grocery store for someone over 60 with a borderline top number. So let me bring this back to where we started, in that exam chair with Eleanor, hearing the words second medication and feeling the floor tilt a little. The honest summary of everything we have covered is this. After 60, your arteries are stiffer and your nitric oxide is lower, through no fault of yours, and that is why the top number climbs even in people who do most things right. But the 3 levers, volume, pipe width, and pipe flexibility, still respond to what lands in your grocery cart. Beets for the nitric oxide most days of the week. Potassium-rich produce like bananas at most meals, with a doctor conversation first if your kidneys or your medication list say so. Plain oats, not the packets. A small daily handful of unsalted nuts, and plain yogurt back on the list. None of these is dramatic on its own. 2 points here, 4 points there, 7 points somewhere else. But blood pressure is a numbers game won in small moves. And remember the DASH trial from earlier, the NIH study in the New England Journal of Medicine. That is what it demonstrated. When the moves stack into a whole food pattern, systolic pressure came down by around 11 points in the people with high blood pressure, the people who needed it most. And that stacking is exactly the path Walter took. He did not cut a single thing. He added potassium-rich produce at most meals, beets a few times a week, and a daily handful of unsalted nuts. And within about 12 weeks his home readings had settled out of the 140s and into the high 130s. That is not a cure, and it is not a substitute for your prescription. It is a set of tools, with evidence behind each one, that you can start using at your very next meal. Buy a home cuff, measure the same way at the same time each morning, give the changes 8 to 12 weeks, and bring the log to your doctor so the 2 of you can see what is actually happening in your system, not what either of you assumes is happening. If someone you care about is over 60 and takes their blood pressure at the kitchen table, a spouse, a sister, an old friend who mentioned their numbers last week, send them this video, because the food conversation is one their doctor rarely has time to finish. And if it helped you today, a like tells me to make more like it, and subscribing means you will not miss what we cover next. Take care of that heart of yours, and I will see you in the next one.